Hello, good morning, good afternoon. A very warm welcome to you all to WHO Africa briefing, today's briefing. A very warm welcome to everybody. This is a first briefing which will be focusing on public health emergencies across the region and including the massive flooding in Southern Africa and other emergencies in other parts of the African region. Some first housekeeping that we need to keep in mind. We're having interpretation into English and into French. So click on the globe at the bottom right of your screen to choose a language in which you'd like to follow the press briefing. So joining us from Brazzaville is Dr. Abdurrahman Diallo, our Director of Program Management. We also have Dr. Marie-Roseline Belizer, who is our Regional Emergency Director. Also on the panel, we have Dr. Patrick Otim, who is the Program Area Manager, Emergency Response. And joining us from Nairobi is Dr. Dick Chamla, who is a Program Area Manager, Preparedness. A warm welcome to you all once again. To kick us off, I have the pleasure of inviting Dr. Diallo to give us an overview of the ongoing public health emergencies in the region, as well as all the action that are being undertaken to respond and to save lives and communities. Over to you, Dr. Diallo.
Thank you. Thank you very much, Otto. Can you hear me very well?
Yes, you're clear.
Terrific. Dear colleagues, members of the media, ladies and gentlemen, good morning. And thank you for joining us for our first media briefing of 2026. Let me start by wishing you all a happy and prosperous new year. Today, we will focus on public health emergencies across the region. As you know, our region responds to around 100 health emergencies every year. Currently, in Southern Africa, heavy rains and severe flooding have affected hundreds of thousands of people in Mozambique, South Africa, and Zimbabwe, and caused extensive damage to critical infrastructure such as schools, health facilities, roads, and bridges. Our WHO Regional Office for Africa, through the Regional Emergency Director and colleagues from our emergency program, will provide further details on the ongoing flood disaster response and on how WHO and partners are supporting the efforts to provide emergency assistance to the affected communities. But let me mention that these floods and natural disasters in general have direct impact on health. For example, there is a heightened risk of water and vector-borne disease due to the displacement and disruption to basic services occasioned by the widespread floods. More broadly, we are witnessing a clear pattern between extreme weather and health. It is a reality confronting our continent with severe consequences. The convergence of climatic shocks, fragile health systems, and infectious disease threats are accelerating both the frequency and intensity of public health emergencies. At the same time, the African region is responding to infectious disease outbreaks, including cholera, mpox and diphtheria, and Marburg virus disease. In a few minutes, my colleagues will provide further updates on those. But let me touch briefly on the ongoing outbreaks. First, cholera, for instance, is not just a disease. It is a marker of systemic vulnerability. Preventing deaths requires rapid surveillance, pre-positioned supplies, oral cholera vaccination where appropriate, and urgent investments in water, sanitation, and hygiene. Ladies and gentlemen, cholera is as much a public health problem as it is a development priority. As such, we need further shift to reinforce health systems and ensure they can withstand shocks such as those due to climate change and maintain continuity of essential services. Secondly, the ongoing diphtheria outbreak underscores persistent gaps in routine immunization, often exacerbated by displacement, and security and disrupted health services. Diphtheria is preventable. No child should die from a disease we know how to stop. Restoring and protecting immunization services, even in emergency settings, is a non-negotiable priority. The good news is that we have made remarkable progress as a region in disease prevention and control. For instance, recent experiences in responding to disease outbreaks, such as Ebola and Marburg virus disease, have reinforced a critical lesson. Early detection, rapid response, and working collaboratively with communities are decisive actions. The region has gained commendable expertise over the years in responding effectively to these threats. Across all these threats, one message is clear. Preparedness saves lives. But ladies and gentlemen, preparedness cannot be episodic. It requires sustained financing, political commitment, and trust between institutions and the communities they serve. As WHO, we will continue to provide the expertise and support to countries across the region and work closely to address the health threats and protect our communities by ensuring that universal health does not simply remain an ambition, but a reality. Thank you very much for your attention.
Thank you very much, Dr. Diallo, for those opening remarks. And now I'll hand it over to our studio and to Dr. Belizaire to give us an overview on the operational work that we're doing on the ground to respond both to the ongoing flooding in Southern Africa, as well as on other emergencies across the region. Over to you, Dr. Belizaire.
Good morning. Thank you, Otto. Good morning, everyone, and a very warm welcome to the journalists joining us to this press briefing. As Otto mentioned, we will be holding this briefing once every month going forward. So let me begin by echoing Dr. Diallo's statement that the widespread floods in southern Africa are not only a humanitarian emergency. Indeed, they are a multiplier of public health risk. When health systems are already strained, floods and natural disasters in general exert further strain, interrupt routine health services, and limit access to care for the most vulnerable, and particularly women, children, older persons, and people living with chronic conditions. In close coordination with national governments and humanitarian partners, WHO has taken immediate actions to support the affected countries through the following activities. Emergency health operations have been activated, with national rapid response teams deployed to support disease surveillance, outbreak investigation, and health services continuity in flood-affected districts. We are supporting ministries of health with essential medical supplies, including emergency health kits, cholera treatment supplies, and infection prevention and control materials. Technical assistance is being provided to restore disrupted health services, including maternal and child health, immunization, and management of chronic diseases. We are strengthening community protection in collaboration with the affected communities, working with local authorities to ensure communities receive timely, accurate information on safe water use, hygiene practices, and when and where to seek care. Climate-related shocks are becoming more frequent and intense. They require sustained investment in preparedness, health system resilience, and climate-informed health planning. Alongside climate-related emergencies, The WHO African region continues to face complex and overlapping disease outbreaks. Looking back at public health emergency trends in 2025, the region responded to 100 emergencies, including 12 humanitarian crises and 88 disease outbreaks. 4 of them are viral hemorrhagic outbreaks. You can recall Ebola in Uganda and DRC, Marburg in Ethiopia and Tanzania. All those hemorrhagic outbreaks were contained with 90 days. The region has also reported around 25,000 suspected cases of mpox and over 1,300 deaths. The year 2025 also saw an increase in conflict-driven humanitarian crises, which continue to cause population displacement, putting additional pressure on the already strained health services. Cholera remains a major concern, particularly in flood-prone and conflict-affecting settings. Mpox continue to be reported in several countries with evolving transmission patterns. Yes, but we are working closely with national authorities and partners such as Africa CDC to enhance disease surveillance, laboratory confirmation, treatment and community-based risk communication in order to reduce stigma and improve early care seeking. Diphtheria outbreaks have re-emerged in part of the continent that reflect a gap in routine immunization coverage. Our priority is to sustain control to prevent resurgences. We are supporting catch-up vaccination campaign in collaboration with partners like Gavi, the Vaccine Alliance, UNICEF, and health workers training, among other measures, to prevent further spread and protect children. Viral hemorrhagic disease, including Marburg virus disease, remain a constant threat. While outbreaks are relatively rare, their impact can be severe. In early 2026, trends show a decline in mpox, cholera, and diphtheria, and that it is thanks to intensified response. The outbreak of diphtheria that affected 8 African countries in 2025 is on a downward trajectory, with fewer than 100 cases reported in the week ending on 20 January, compared with around 800 cases a week that were reported at the peak of the outbreak in first week of November 2025. The mpox outbreak has also slowed down. Only 16 countries are currently reporting cases, active outbreaks, with 200 cases so far, to compare to 5,000 cases in January 2025. Thanks again to rapid and concerted response, Ethiopia has reported no new cases of Marburg virus since 13 December 2025. And it's now on the course to declare soon the outbreak over if no new cases are reported. So public health challenges are significant in Africa, but they are not unsurmountable. With a strong national leadership, sustained international solidarity, and investment in resilient systems, we can safeguard the health of our communities. Our support to countries is anchored in 3 strategic pillars. The first one is preparedness and surveillance. We are investing in integrated disease surveillance, system, laboratory, networks, and workforce training to ensure outbreaks are detected early and acted upon swiftly. The second is emergency response and health system continuity. During crises, whether floods, epidemic, or conflicts, we work to ensure essential health services continue, supply chain remain functional, and routine frontline healthcare workers are protected and supported. The third pillar is resilience and long-term capacity building. Beyond emergency response, we are partnering with government to strengthen climate resilience health infrastructure, expand immunization coverage, improve water and sanitation in health facilities, and embed emergency preparedness into national health plans. So WHO remains fully committed to working with countries before emergency strike, during crisis, and in recovery, so that every member of every community can access the health services they deserve, the health services they need, even in the most difficult circumstances. Thank you.
Thank you very much, Dr. Belizaire, and indeed to Dr. Diallo as well for those opening remarks. Now we will be opening up to reporters' questions, and just as a reminder that we will be taking, as this is a media briefing, we'll only be taking questions from reporters. Kindly use the Q&A function on Zoom, or you can raise your hand and we will give you the floor to ask your question. Please do mention the media house you're working for and the question and the person to which you'd like that question to be directed. We will then start with the first question, and this comes to you, Dr. Diallo, on the heels of the announcement last night about the US withdrawal. And this is from Peter Mungangi, who works for BBC Africa. It's a three-part question. I'll read them one by one and maybe take them down, and we get your response on this. The first of which is that we've seen that the US has withdrawn from WHO. What does this mean for Africa? The second part of the question. The second part of the question is that what programs are being supported by the US funding in Africa, and what adjustments are being taken? And then the third is, could you specify the figures involved in the above? If not too clear, I can retake the questions, but over to you, Dr. Diallo.
Yeah, thank you. No, I'll do the best I can. Oh, am
Thank
I
you.
on mute? No, I'll do the best I can. No, it's a very interesting and very timely question. What I can say is when the US joined the WHO, it reserved the right to withdraw on a one-year notice, provided that it fulfills its financial obligation vis-a-vis of the organization on the current year. So last year, on the 22nd of November, we received the notice. And yesterday marked the 1 year. Yesterday was the 1 year mark from that notice. So this is still fresh for us after the 1 year notice. What I can tell our partners here is that this is on the agenda of our upcoming executive board, which is on the first week of February. So we are actually getting ready to travel. So we, WHO as Secretariat, will act on the guidance and recommendation from the executive board. So as soon as we know more, we will share with them. So how this has affected our overall support, I think this is pretty clear. We've been saying this all along for the whole year. The US is a great partner to WHO, a major contributor. Unfortunately, losing that funding caused major disruption to the services that are being provided to countries, jeopardize progress made to date, and it can compromise scaling up interventions that have been proven to be impactful. So we, as WHO, have been working with member states to support them in adjusting to this new development, looking at their work plans and prioritizing and making sure that critical interventions are, like I said, are prioritized. And for us, WHO internally, it's been tough, but we saw this also as an opportunity to re-engineer the organization. I think everyone knows that we put in place efficiency measures to revisit our expenditures. We went ahead and reprioritized our interventions and realigned our staffing structure, which resulted into a significant reduction, which is around 17% of reduction of our staff moving forward. So yes, that's what I can say to that question.
Thank you, Dr. Diallo, for the responses. We will take them as we go along and expand on them. We have a report on the floor. Saida Rashid, if you could, colleagues could unmute her to ask the question, and please mention the media house you represent. Carry on. Saida, you able to speak? Okay, let's move on with the next set of questions. This is still also related to the US withdrawal, and perhaps I'll have this to Dr. Chamla, which relates to our work in Nairobi as well. So this is coming from Helen Shikanda, who works for the Daily Nation, which I think is a Kenyan newspaper. And the question is as follows. Nairobi serves as a critical hub for regional diseases surveillance. Now that the US has withdrawn and its technical expertise no longer coordinating through the WHO, how will this impact Kenya's ability to detect and respond to cross-border outbreaks like Ebola or any new COVID variants in the East African region? Dr. Chamla, this is over to you. You can also flesh it out with information on our trends on preparedness. Over to you.
No, I really appreciate Otto, and good afternoon, everybody. I'm Dr. Dick Chamla here in Nairobi, and I'm leading the emergency preparedness team. I hope you hear me pretty well. Actually, it is really interesting question, and I think it was already partly answered by our Director of Public Program Management. Actually, as a statement, I would really like it to actually commence here. A public health emergencies, flooding are not really new in the region and in the world. And as a WHO and other partners, we have been already started to have some tools and infrastructure in which at the moment we are actually able to even predict being actually what kind of hazards actually in which it will happen or not. As a result, we were aware of the upcoming hazard. We were aware of public health emergencies in which would be actually likely to happen at the time we're flooding. Specifically to your question, and actually it's true, Nairobi Hub now has become a gravitas of the regional partnership here. As you have heard from the US withdrawal from WHO and actually the changes in the global health architecture, so we have a lot of the UN agencies now are transferring on their headquarters here, actually in Nairobi. So we have also had on the UN actual humanitarian research efforts, UN 80 efforts in all actually trying to rebrand themselves and also try to reorganize actually our partnership with landscape here in the region. As a result, it's true, it's very unfortunately, is that United States has withdrawn and also has reduced its presence here in the region, but we have a strong regional partnership also in which, as you have heard from our Director of Emergencies, in which WHO is collaborating now with Africa CDC, with African Union. We have also a regional economic communities here like SADC, East African communities, and WAHO, in which we are all playing actually a critical part in strengthening the capacities of our member states, including Kenya. As a result, it's true there had to be some few adjustments, etc. But it is our we actually able to address any of the gaps which will be left behind. I mean, our problem in Africa, actually, Africa is the least preparedness region, actually, in the world, as you know that. And I think it is one of the reasons we have the multitude and the recurrent outbreaks, as you have heard it here before. And the climate change issues, the armed conflict is another angle in which is actually it complicates our efforts as well. For instance, you have heard about the cholera here. Everyone is talking about the cholera because at the time when the flooding, the risk of cholera is actually at its peak. In Africa, we are trying to address the issue of cholera preparedness because now, for instance, in the last year, our heads of states in Africa had the meeting in Lusaka in which have come up with a call to action. I've been interested to really only talk about 2 actions in which Africa-led efforts will be actually prioritizing. The number 1 action is creation of the robust cholera continental task force, in which it will be at the head of state level and supported by a steering committee in which it will be coordinated by WHO, Afro, and Africa CDC. We are also bringing on other UN agencies like UNICEF and others. As you are all aware, the cholera, it isn't only a health issue, it's also a developmental issue in which we will need to have a long-term investments, for example, in water, and other areas.
Thanks.
The action in the call to action is the local production of the medical countermeasures. And here I'm really talking because it's higher in the political agenda. And we feel with all these strategies, we will be actually able to address the impact of United States withdrawal. Apologies, I've taken a lot of time. Thank you.
Thank you, Dr. Chamla, for the elaborate response. And I think tagging on to that, to a question that also relates to the ongoing impact of flooding in Southern Africa, we have a question from Charles Mboglu, who works for TRT. And perhaps Dr. Tim, I'd send this your way to look into this question, also expound a bit on the work we're doing in Southern Africa. And maybe also I'll call on you, Dr. Belizaire, if you have any complementary responses to that. So the question goes as follows, is that we've seen hundreds of thousands of people affected by ongoing floods in Southern Africa. Is the region now facing a multi-country public health emergency? That's a question. And are national health systems at risk of being overwhelmed? Dr. Otim, and then okay. Dr. Belizaire, if you can complement.
Thank you very much for that question, Charles. First of all, as mentioned, we are a region that is accustomed to responding to public health emergencies. And every year, we respond to over 100 public health emergencies. And of all the emergencies that have been listed, a number of them are multi-country. So mpox had affected up to 32 countries. Now it's down to 16 countries that we have active outbreaks in. Cholera had gone up to 23. Now we are down to 12 countries where we have active transmission. And diphtheria also affecting 8 countries. So we've had a number of multi-country emergencies. The systems are stretched, but it's not at a point where the systems or the capacities in the countries are being overrun. Now, a number of measures have been put in place to enable countries to be able to deal with these emergencies. Increasingly, we've established public health emergency operation centers in countries that helps them to be able to coordinate on an all-hazard-based approach multiple emergencies at the same time. And we've worked to integrate across different emergencies so that we maximize the resources and the technical expertise that is there to be able to deal with the emergencies concurrently. So I believe that, of course, it puts significant stress on the resources in countries. It diverts a number of healthcare workers from the routine service delivery to address the emergency needs, but there is sufficient capacity within the region to be able to address that. Secondly, we've also invested over the last 2 years in developing what we call rapid responders AVOC that are trained in each country that can be activated and deployed to reinforce. But on a basis of solidarity, of the 2,300 healthcare workers we have trained in the region, countries are supporting each other. And usually when one country is having challenges and there is need for additional expertise, so we are able to deploy across borders to be able to reinforce. So this is the South-to-South collaboration, and we've seen it working very well. It worked with the Marburg outbreak in Rwanda, in Tanzania, and even the mpox. We've seen a lot of experience sharing and expertise being moved across borders to ensure that we sustain delivery of critical services even as we respond to emergencies. Now, I'd like to, if you allow, I think, just make 2 comments on mpox, because I also see there is a question from a colleague, Rashid, on the mpox, so that we can also address it at once. Now, as you know, mpox was declared a public health emergency of international concern in August 2024, and we have had concerted effort to respond across the continent, working together with Africa CDC. And last year in September, after significant progress was made both in the epidemiology and also the availability of vaccines and response interventions, the public health emergency of international concern was lifted. And therefore, when you look across the region now, over the last 6 weeks, we have had over 61% decline in cases. So at this point in the year, we are seeing the lowest number of cases we have seen since 2024. And all this is really testament to the collaboration we've had, but also the efforts and investments the countries have made to address mpox through increased surveillance, through engaging with the communities and different networks that are contributing to this, and also through rolling out vaccination. And we have had so far over 1.4 million people vaccinated against mpox in the continent. So significant progress made there. Thanks, and over to you.
Thank you very much, Dr. Tim. Dr. Belizaire, maybe if you can complement and also let me throw in this question, same from TRT, Charles Mbogu. In what way, and I think you mentioned it in your opening remarks, what immediate actions and resources are WHO and African governments deploying to prevent flood-affected related disease outbreaks from spreading or spiraling into a regional health emergency? So maybe just a summary of what we are doing to respond to stop any other spread of potential disease outbreaks.
Okay, thank you. Thank you, Otto, for the question. It is actually, as you said, a summary of what we are doing to support our member state in the WHO African region. So as I already mentioned, WHO, we work with national government. We are not going alone in the field, and we implement a package of immediate response measure, including the surge capacity, as my colleague Patrick already mentioned, but we also, with those human resource capacity, we work on strengthening disease surveillance and early warning system. That means so we can know or capture any detection, precoce detection in the community for cholera, malaria, measles, and other water and vector-borne disease. As you know, when we have floods, those diseases become more prominent and more active in the community. So we also support emergency water sanitation and also hygiene, like it is also a gap we still have, but however, we are putting also intervention in that area. We also deploy a medical team that it is a possibility for now when we talk about that global solidarity, continental and global solidarity. We have emergency medical team on standby if the country has a need and it is requested, so we can quickly make these human resources available. And when those emergency medical team are deployed, they are not deployed only human resources, they are also material and supply that go with that mission. So we also preposition essential medicine, okay, in order to help our country. And we have a setting of mobile clinics so that people can seek care when they need it. So risk communication and community protection, as I mentioned before, is really important. And that we do it in very close collaboration, very close partnership with the communities themselves, because we are working with the community, for the community, and for the health of the community. So we work together with them in order to make them aware of the risk that is incurred when we have those floods ongoing in the place, and mostly when they are displaced in other situation, in other area where they have water is not available. So we do that for the community. Thank you.
Thank you, Dr. Belizaire. We have a question from Usman Yahaya, who works for Afif TV in Nigeria, Afif Track News, Lansan Radio in Nigeria, and it also relates to flooding. So I'll also still come back to you, Dr. Belizaire. Other colleagues have complementary responses you can also chip in. Many communities affected by flooding are also facing ongoing conflicts, which limits access to health services and clean water. How is WHO adapting its emergency response to ensure that displaced and conflict-affected populations receive timely support for disease prevention, treatment, and vaccination? So I know you've touched a bit on this, but maybe if in communities where there are layered challenges, including conflict and population movement, over to you.
Thank you. Thank you. This is a very, very important question and a very to the point question, actually. So in area affected by both flooding and conflict, WHO adapt its response though, So we adapt it by putting in place mobile health team and outreach clinic and outreach team in order to go to the community and find every member of the community where they are, to bring them that the necessary care that they need. So we also make integration of health system services into humanitarian access corridor. For example, if we have displaced population, we put in place on those, we use first the infrastructure, state infrastructure or any NGO infrastructure already existing in this area, and we can reinforce their capacity. If there is no existing capacity in that meaning, so WHO is responsible to implement that capacity, putting in place, sometimes in the first day, it could be a tent when we put, and under that tent, you have a clinic in it. So we also pre-position supplies. So Dr. Chamla mentioned that now we are more risk informed. We have tools that we develop in WHO that can inform you of the risks of coming. We have also another program, which is the emergency support. And with that, we preposition the material in those places. You will see, for example, all the countries at risk of cholera, they already receive cholera kit to preposition. They already start with a risk communication to inform the community of that risk. We also strengthen partnership with NGO, local NGO, because it's really important to go to localization, that these communities feel safe with those people they are working, because they already knew those local NGO before the incident or before the conflict. So it's important that we maintain that trust in the community. So we work with local NGO and also international NGO. We also use negotiation for access mechanisms. For example, if we have access of difficult, if we have the conflict, if we have armed conflict, we also negotiate access in order to reach the member of the community. In those settings, we also prioritize vaccination, as for example, in Burundi, where we have a displaced population resulting from the conflict in DRC. So we have putting already in place a vaccination. We also give a very, I can say, high importance of maternal health, that every single woman can deliver with dignity whoever she is and wherever she is, even in humanitarian setting. So health services are there. We also treat like a common chronic diseases, because if someone is on HIV treatment, on tuberculosis treatment, high blood pressure treatment, they shouldn't stop. Reason why, the first thing we do is to put the health evaluation, what we need in order for the response to be proportional to the need of those community. So equity to access in conflicts and also in outbreak response is very important, and it is a core principle of our response in every country where we are supporting the government. This is what I can say regarding that question. Thank you. Over to you, Otto.
Thank you for the elaborate response. Dr. Diallo, you want to comment on that? Oh, you're muted, Dr. Diallo.
Oh, thank you. Totally subscribing to what Dr. Beliza said. Just I'm bringing up one dimension in humanitarian crisis and outbreak. It's just reminding our partners of the media the need for a holistic approach. So one critical thing is coordination and integration, because in such setting, the needs are huge. There is, of course, the health component. There is also the need for shelter sometimes. There is food, there is security, and like Dr. Beliza said, there's access, right? So just taking, and most of the time WHO leads the health component of this holistic approach, but it's difficult to take it separate from the rest. Usually integrated response task forces are put in place, and like I said, WHO leading the health component, but closely, like Dr. Beliza said, working with all other partners covering all these other aspects that are essential to WHO's ability to actually deliver the health component of this. In some settings, and Dr. Beliza and her team here can expand on it, I remember them educating me recently on our response to Ebola in Bulape. While in terms of health response, we had what it took to support the response with other partners, but access to water was a challenge. WHO found itself in a situation where it had to actually lay down pipes and put together connections to ensure availability of water. Maybe Dr. Mary Roseland, you can expand on that, because it's a great example, I think.
Thank you. But before I give you the floor, let me just take one quick question, and then you can comment on that. It touches on response, and I think it's a good segue into that. So this is a question from Reuters from Nelly Payton, and I'd request Dr. Tim and then maybe Dr. Belizaire to comment on that. It goes as follows: do you have any initial assessment of the health impact of the floods in South Africa and Mozambique over the last 2 weeks? Any initial assessment on that? Dr. Tim, and maybe Dr. Belizaire, with the questions from Dr. Diallo, you can expound that a little bit.
Okay. Thank you. I think assessments are ongoing, but the preliminary information we have, starting with Mozambique, for instance, that there have been massive disruptions in the critical infrastructure, particularly in Gaza, in Maputo as well. And there are reports that so far 44 health facilities have been destroyed. So that means that then service delivery is interrupted in those areas. Then you have over 50,000 people who have been relocated to shelters. And now those people in the shelters where they are of course, there may not be services available. You need to be able to put in place services for them to continue, those who have been on medication, and address some of the emergencies. Sometimes people get injured because some facilities or houses are collapsing, and all those things will require emergency medical care. So that's a critical one. Of course, during flooding like this, we always end up losing the stocks that are there of essential medicines. So it's critical at this point that we are able to replace those medicines that have been washed away by the rains, and that we are able then to ensure continuity of access to essential care. There is the issue of the contamination of water sources, and that then really heightens the risk of cholera outbreak, and therefore working to be able to restore access and to safe, clean water at this point is a very, very important aspect for both those who are displaced into the safety accommodation shelters, but also those who have remained behind whose water sources have been contaminated. For South Africa, in Limpopo and Mpumalanga, there have been similar disruption, not to the extent in Mozambique, but efforts have been ongoing to try to restore access to safe and clean water, and also to ensure that people receive the emergency medical care that they need. So really, three key things: restoring access to healthcare, replacing the medicine, the supplies that have been lost, and then the issue of access to safe and clean water. Then, of course, the other aspect, looking at the human being holistically, there's the issue of the shelter, where do they stay, and as the DPM has mentioned, all the other components of the holistic humanitarian response that would be in place. Thanks. I'll yield to Dr. Marie-Roselyn for the rest.
How about you, Dr. Belizaire?
Yeah. Okay, thank you. Maybe just to add, Patrick already covered all the aspects that we are supporting. Just to add, there will be a mission, an integrated mission, coordinating by OSHA, that will come from Geneva. We are WHO also members. So that mission has an objective of a big assessment, integrated assessment, as we mentioned, with all the aspects of the humanitarian response: shelter, access to water, food, everything. So this mission will be landing in the weekend in Maputo, and so in Mozambique, and will cover also the certain region, all the other countries affected. So now, regarding how we support now member states after outbreaks, it is to implement our framework that we call HEPER. HEPER stands for Health Emergency Preparedness, Response, and Resilience. So that means after an emergency, we should leave the place where the emergency has occurred better than we found it before. So this is we're starting doing in DRC. When we went to DRC in that area, access to water was a very big problem, not only for the community, but to set up the center for treatment for Ebola. That is really important to have water in the clinic in order to prevent that. So what we did, we put in place a water pipeline for more than 2 kilometers from the river to bring water to the community. So actually, more than 1,000 people have access to safe and clean water in that community. This is how we live that place better. Other action also that we conducted, we didn't have electricity. For us, we have to bring a big generator from Kinshasa. And this place, we have done to rent a helicopter. So what we decided, we leave also a plant of a panel solar. So now the hospital has access to clean energy. The population also have access to energy. So this is to put in place, the Diallo mentioned, that we are leaving the places better than the way we found them before an emergency in order to contribute to the health system resilience. Over.
Thank you very much, Dr. Belizaire. We have a hand from the floor. Apologies, I can't be able to see the name clearly. But if you can identify yourself and put your question across, could we unmute the person? We have a hand on the floor.
Good afternoon. Is it me? Maybe if
Yes, carry on.
Okay, I am Jamkama Logius. I'm from Uganda, Mama FM. I asked a question. I don't know if it has been responded, but I was asking Dr. Murray to maybe highlight more about the current outbreaks that they are managing. But also she mentioned about 16 countries which are still registering mpox cases. I am seated on my computer, so I wanted to put them down, but she was, over speeding, and I didn't get the countries, and I don't think that she mentioned them, so she can help some of us who are really noting down.
I reckon we could send you that over with the 16 with the names of the countries, or
Yes.
unless maybe you
Yes,
do
I
have
was
them.
I was going to say that we'll send him, but before
Right.
my director comes, I just wanted to say in terms of outbreaks, we have 5 major outbreaks that we are dealing with, and of course we have small outbreaks that we are following. We have Lassa fever in the West African belt and all the others, but they are not big. So the ones that we are dealing with, we have the cholera, which is still multi-country. We have the mpox, which is also multi-country. We have the diphtheria that we are dealing with. We're just winding up a Rift Valley fever, which was affecting Senegal and Mauritania, and now we are going to we are working with the countries to declare the end of the outbreak. And then we had the Marburg, which was in Ethiopia, which we are now towards the tail end of the 42-day countdown. If there is no new cases between today and Sunday, and the country will declare the end of the outbreak on Monday. So those are the major outbreaks that we are dealing with. In terms of listing the countries affected by both cholera and mpox, so if we can put his email, we'll send him the list after this. Over. But
Great.
of course, we also have the humanitarian crisis we shouldn't forget. So we have a very big humanitarian crisis with the conflict in Sudan that has resulted in displacements across the border into 4 neighboring countries. Over 4 million people displaced, South Sudan and Chad receiving the highest burden. We have the conflict in Eastern DRC that has also displaced so many, with Burundi receiving over 90,000 displaced people. And then we have the security situation in Cabo Delgado, in Mozambique, and also we are monitoring as well the South Sudan humanitarian situation itself. So those major humanitarian crises, in addition to now this flood, which is affecting 5 countries in the Southern Africa sub-region, they remain are very critical emergencies that we are following. Over.
To
Thank you
add
very much,
something.
Dr. Tim. Maybe when you're coming in, I have one round of question that I'd perhaps like all our panelists to look into. It also goes back to the issue of the US withdrawal, and maybe if we could have one word each on that, and we can complement with further information to the reporter. This is coming from sorry, let me just read this over from BBC, Agnes Pender, and it's about, she's asking about which programs will be affected by the US withdrawal from WHO. I know, Dr. Diallo, you mentioned a few programs, including HIV, including NTDs. Maybe you can retake that, and then Dr. Belizer, we come to you. You can also mention a few, then we start rounding off as we wind up the. I know we have Dr. Chamla. You had also mentioned in your remarks when you started about the preparedness and the areas in which we will witness impact. So over to you, Dr. Diallo, and then Dr. Belizer, and finally Dr. Chamla for that reminder. Thanks.
Right. So yes, thank you, Otto. No, typically the way funding comes to WHO is through the assessed contribution and then the voluntary contribution. This makes the programs impacted by this withdrawal vary depending on the country. But overall, there are priority programs that have been traditionally supported by the US government, such as HIV/AIDS. I think many of us are familiar with the emblematic program of the US government, which used to be known as PEPFAR, the US President Emergency Plan for AIDS Relief, specifically dedicated to HIV/AIDS. So modifications to that program overall affects delivery of HIV/AIDS, but also malaria through even the PMI, US President Malaria Initiative. So malaria is affected, tuberculosis is affected in some cases, other infectious diseases such as the neglected ones, the ones that we call neglected tropical diseases, and even immunization programs are affected. And my colleagues here can further talk to the impact on emergency preparedness and response as well. So overall, I think programs that are affected vary from country to country depending on each member states, each donor's priorities and interest for that particular country. But in the case of the US, those are some of the major programs that have been affected.
Thank you, Dr. Diallo. In terms of emergency programs, Dr. Belizaire, and then we go to Dr. Chamla.
So in emergency response, Dr. Diallo mentioned how the funding is flowing to WHO. So, but specifically, we can say that US CDC was a very strategic and operational partner with the emergency program. So losing them has been a big, I can say, loss for us. So we were working together in cross-border surveillance and also in cross-border response when we have an emergency. And they were supporting a lot the response to mpox. So I remember in countries where the funding only came from the US, the response have stopped in some of the countries, for example, the Central African Republic. So we were really collaborating with the US in a lot of area responding to emergencies. Maybe I will give the floor to Dr. Chamla that can talk about preparedness. So one additional information I wanted to share is that during the time we are having that press conference, I just received the information that the Como declare an mpox outbreak with 4 confirmed cases. So that's to reiterate that outbreak emergencies and humanitarian, they are going together. They are really intensifying in the region, and reason why we really need partnership, collaboration, even with media, to share the information that we are giving them, to give that information to community so community can know how to protect themselves. Over to Dr. Chamla.
Thank you. Dr. Chamla, we still have you on board.
Okay, I will only add a few things here in which were not actually mentioned. I think in preparedness, if we will start at the upstream level, I think US was a critical partners in the pandemic treaty negotiations and the amendments of international health regulations. For its substance, it really eroded an element of a global solidarity and equity, as you have heard it here. Therefore, up to now, we haven't really known actually to which extent it will impact actually the implementation of the global instruments on the ground. Another issue also in which US was really helping in preparedness is the issue of One Health approaches in our programming in emergencies. As you know, over 2/3 of our public health emergency high threats are actually originating from animal. And the US was really a critical partner as well on that, as a reason that we see it is another area it might be actually impacted. And actually on the last area here is the issue of the readiness, because US was actually our critical partners in readiness assessment of the countries and to actually see how our member states are prepared and actually ready to respond. And we've been collaborating excellently with institutions in USA, for instance, USAID, and also actually US CDC. I'll end up here. Yeah, over from me.
Thank you, Dr. Chamla. We are coming to the end of our briefing today, and we will hand it over to Dr. Diallo for closing remarks on that. Dr. Diallo, if you can take it so that we bring it down to a close. And sincerely thank everybody who has joined and the interest they have in WHO and its work. Dr. Diallo, over to you.
Oh, thank you. Thank you, Otto. No, I think this part is simple for me. I just want to take this opportunity to thank the media for their time and interest in WHO, but particularly for what we do in emergency preparedness and response. I just want to reiterate the critical role that the media overall plays, not only in advocacy, but also in educating our communities. We typically call it community engagement, risk communication, but also in managing mis and disinformation. So the media are really critical partners, and they've played this role pretty well. I just want to take this opportunity to profusely thank them and appreciate their partnership. We value it more than you think, more than you can imagine. So thank you so much. I also want to take this opportunity to thank the organizers. So the regional director for setting this up, and the regional emergency director, Dr. Belizer here, the PAMs, the program area managers, the entire emergency management, emergency preparedness and response team for working very hard to make this a reality and for prioritizing media engagement as part of their communication strategy. So thank you very much and great work, team. And I also want to thank our great communications team. From the moment this came up, the whole team got engaged, got enthusiastic, and worked closely. Everyone went beyond duties and expectations to make this happen and help us set up, make sure it's a success. I just really want you guys to know that we value your great work and appreciate what you do to help us greatly engage with the outside world and our media partners. So finally, I just want to reiterate WHO's commitment again to work with the media. Congratulations, Dr. Mary Roslin, you and your team for committing to make this a recurring setup pretty much once a month. So this speaks highly for our determination to be transparent, our commitment to engage with the media to make sure that in a very open way, they have accurate and up-to-date information. And we also provide the possibility for them, even outside of this, to reach out so that the right information is conveyed. So thank you all very much for this successful session.
Thank you very much, Dr. Diallo, and thank you to each and every of our panelists. We've come to an end of our briefing today, and as mentioned, we'll be holding this monthly, and we hope to see you again in the next edition. Have a very good afternoon and the rest of the day, wherever you're joining us. Bye.